I hope you appreciate the title as the extent of my creativity in full display here. I'm glad we're talking about this today because I don't know about everyone else, but I think we've been through Omicron and its peak thus far in January, and we've been through many cycles. And those of you who've been on ECHO Coping with COVID for some time, we've been on quite a journey together over the course of the pandemic. So I really find this fitting. I hope it's going to be cathartic for me as well, just to be able to talk with all of you about this, because I don't know how everyone else is feeling, but I feel like I have some cautious optimism, but I know I've been in this place before. So, so I do want to open my presentation with that, and hopefully we can have some more discussion on kind of readjusting to reopening 2022. Might be reopening. We might have to label it by seasons as we go, but we'll see how it goes. No change in my disclosures. I have a little bit of evidence that I'll talk about. This here just refers to the in-kind support from CAMH and from Ministry of Health that we've received for this program. And I mentioned I'll talk about a few studies, but really it's about experiences. That's what I'm going to talk about mostly, and I hope we can have lots of discussion together. So these are the learning objectives. Just a little quick kind of update on mental health trends and where we're at. And then to talk about kind of reopening post-Omicron, and we can have a discussion, are we post-Omicron? People can have that discussion too. Identify strategies to cope with challenges and the distress related to reopening. And I think that's going to be part of our joint discussion. And a presentation by me on ECHO Coping with COVID would not be a presentation without this slide. So I got to stay true to form here. But again, I've said this before. I think there's great irony in this, and that this was the slide that we used in the first month of COVID-19, and so April 2020. The timelines do not apply any longer in terms of the approach, and I think the peaks and valleys are very much different than what we would have expected and predicted in early 2020. I do think the phases are still quite relevant to us. They may not be as dramatic given how long this pandemic has gone on for. But I do think, and I don't know how people feel it's gone at the peak of kind of Omicron, but I wonder if in our discussion point, if people want to reflect on one of the questions, which is, was there like a heroic phase and kind of people coming together during this time, during Omicron? Where are we now? Are we in a honeymoon or disillusionment, and kind of checking in with us at this phase? And then the other thing I wanted to kind of raise is also this whole notion of reconstruction and that turbulent kind of path back to quote unquote recovery. I feel like, this is anecdotal, there's no literature that I'm quoting here, but I feel like this work has been done in parallel to those waves that have happened, right? Like we're doing all this work of kind of managing trigger events, anniversary reactions, given that we are kind of 2 years into this. There are different anniversaries of things that have happened during that time, some related to COVID-19, some not as well. And grief and loss as well, that comes in waves and reminders as well, that I think is in parallel to these other blips of kind of the heroic honeymoon and disillusionment phases. So I feel like this is almost like a long-term trajectory that we're being mapped out with superimposed kind of waves and kind of the roller coasters that were going on through this. But that's one of the questions that I had for the group that I hope we can kind of explore in our discussion. And, we're at another phase of kind of reopening. In some ways, a lot of people have talked about this. You might have seen this in the media, that some of the narratives are that we've been through this many times before, and so we're getting better at this maybe in terms of how we manage this. I still, every time have these questions that, what with reopening, what is my comfort level? Where am I at? How am I going to interact with people now as restrictions start to kind of ease? What's my comfort level versus others? And what's the pace at which I'm going to do that every time? And again, I have that optimism, but I'm also kind of a little hesitant and apprehensive as well, because thinking about where we've been and where we're going. I'll just say in the hospital, we've changed our kind of COVID operations at CAMH to back to a return to new normal is our committee name. And every time we go through a wave, we switch the name of that committee, which I think really is symbolic of how we're, the perspectives and where we are on that continuum. This was, if you heard me do the other reopening talk, I think it was in the summer of last year. It's this cycle. And I use this cartoon because there's kind of usually breaking news with each wave, a bit of kind of angst about what does this mean. As there's restrictions, it can kind of cause some loneliness or separation from people that we may or may not have had an opportunity to reconnect with, kind of acceptance of where we're at. And then for some times, it kind of, as the reopening happens, kind of dread about in the initial phase, and then how that changes. And there may be periods of hope and optimism that I think are not on this cartoon as well. And I think we should acknowledge that. I will also say that, the experience is quite varied for different people. If you're working in healthcare, in a healthcare context, or in a community-based context, many of these different phases or stages may have kind of varying degrees of intensity or relevance to you, right? So, and with that, this is one of the new pieces of data that I've kind of shared, and you may have seen this paper that just came out. This is actually quite relevant. I know we have a few people across the country here, but this is Ontario data. Just looking at physicians, which they use very broadly because they included residents and fellows who are licensed with the CPSO. And they looked at mental health visits and kind of healthcare utilization for mental health and substance use before the pandemics. So they looked at March 2017 to a period of time up until a few months before the pandemic, and then March 2021 was the end of it. And the COVID period that they looked at was March 2020, March 11th, 2020 to kind of the same time in 2021. It was that 1 year period. And so a few things that they noticed, that there was a statistically significant increase in substance use visits by physicians. And I use that again broadly, post-pandemic. It's not a lot. If you look at the absolute here, it's a 12.3 before to 13.4. And they looked at the kind of crude annual number of visits per 1,000 physicians, and that increased by almost 30%. Interestingly, I don't know what it says about my profession, but the psychiatrists had the highest visits during this time, and surgeons had the lowest visits. And we can talk a bit more about what we might glean into that. And really interesting was the increase in visits was significantly greater in physicians without a past history of mental health and substance use. And what is that? How do they understand that? It's through past visits, whether through primary care, emergency room departments, or other mental health kind of services like hospitalizations, for example. So, it really kind of highlights that there has been some increase in kind of healthcare utilization and the impact this is for physicians, but I would say we could think about how this extrapolates to other healthcare providers for sure. And we know for sure nursing and other healthcare professions have been impacted significantly in terms of mental health over the course of the pandemic. And then this was from the CAMH survey that was done. And I just want to highlight in May 2020 was the start of this survey. January 7th of 2022 was the last data point. And you can see a few things here. This is for anxiety moderate to severe anxiety was actually a little bit higher than it was at the start of the pandemic. We also see that females had higher rates of anxiety all throughout, and that still holds true. And then people who had children in their household also had significantly higher kind of moderate to severe anxiety than those without children during this time. And likewise for depression, the percentage of depression, again, also higher now. It's probably at the highest peak it's been since the beginning of the pandemic. And same trends for females and people with children as well. That would be likely higher as well. There were also spikes in loneliness as well. So 24% to about 19% compared to July of the summer. That was the reopening in July. Spikes in depression since July as well, and anxiety. And those are more marked, like about 5% differences since the summer in the kind of depression, anxiety, and loneliness as well. And of course, there's other surveys that show like unmet needs, significant unmet mental health needs. About a quarter of Canadians saying that they had unmet mental health needs during the course of the last 12 months. So, that's the backdrop of where we are right now. And I've shown this before when we were through kind of one of the more prominent kind of reopenings after a couple of waves early in 2021. And I don't know if it's the age of reopening. I think this is longer than just an age because it's gone longer than a year. Maybe people can put in the chat what they think we should rename this as the age of reopening, but maybe the cycle of reopening. But I do think, although we've had experiences in practice with this, every time that we kind of restrict our public health, we have public health restrictions that are necessary, it does impact our social kind of circles and social connections. And, these repeated cycles, I do wonder, we don't have great evidence on like social proficiency or social interaction, but what the lasting impact may be from these starts and stops and kind of disruptions in our kind of social connectivity as well. I will say, again, I've said this before, that some people who may have had kind of social anxiety may have initial kind of benefits or comfort in the context of social distancing and kind of the lockdowns, and people who are now used to a bit more of that kind of removal from some of those social contexts. But in the long run, I do wonder the impact of that. And I'll just bring it back to patients. Again, I'll use anecdotal kind of evidence here, but I have a few patients who've talked about significant loss with not coming into the hospital to see me as part of their regular routine, because part of that is not just kind of the care that they're receiving with me, but is the interactions with individuals, that they would have met through the TTC, right? When they walk through the front door, the person they see, whether it's once a month or kind of twice a month, they would see in those interactions in the hospital at the front. My administrative assistant, many people miss her more than me. And so her kind of therapeutic kind of benefit response and kind of that social connection as well. So I do think that although virtual care has extended many of those, there are some exposures and interactions that are part of the therapeutic process of coming in to kind of see someone in person that we kind of really have to kind of think about as well. All right. There we go. So, one of the things that I would like to say is there's probably many factors contributing to reopening. I actually looked at the literature to see if I could tease out, because someone looking at kind of a qualitative analysis or some kind of a process to that. There isn't actually great studies that have really looked at this thus far. So an area of research if someone's interested. there are some themes that have come up more broadly throughout COVID that have kind of permeated. So uncertainty, fear, fatigue, that information, misinformation that we continue to battle, lack of control and social isolation. Like all of these are those same components that we've talked about kind of previously, that I do think kind of influence our adjustment to reopening. And I will still come back to our 4 C's of coping with COVID. Again, and maybe it becomes 5 in the next iteration. But I think, our approach to this and at this phase is kind of controlling what we can during this reopening. Again, you'll see it, my general approach in the next slide, but controlling who we are socializing with, the pace at which we might be doing things each time. How are we continuing our self-care throughout the different phases, including reopening? When we might be experiencing that parallel process of some of those other triggers or factors or experiences that are intertwined with kind of easing of restrictions and kind of social reintegration. How do we kind of explain this, understand this? How can we accept this in a mindful way? And then really the connectedness, and how are we titrating that social connection during the phases of kind of social reopening? And so, these are really the basics that come back, and these are the reminders about kind of structure and routine, really thinking about and being deliberate about the comfort level and our game plan, starting gradually, mindful of our comfort, continue to reflect and check in about how we're feeling at these times, knowing that at which each kind of phase, as we kind of ease restrictions and are kind of interacting more and feeling a bit more freer and comfortable, that's part of the exposure, right, of us kind of easing through each of these phases. If there is angst about this and apprehension, kind of acknowledging those moments that are going well, some of those successes, practicing self-care and stress management. And we do that, here, twice a month as mindfulness or mindful moments, but in other ways as well. Really continuing that connection and enriching that connection with family and friends. And then understanding that these waves each time are difficult for a variety of reasons, and that being mindful for ourselves, as we saw as healthcare providers, some of that data, but also those around us who might come to us for help or support when we might need to kind of recognize, advocate, and help connect them to kind of services as they need it in those circumstances. So that's my kind of just quick synopsis. I was hoping I would find you a fabulous study that would tell you this path to reopening and phases, but it's been a long journey. I do have some questions there, Mark, that I've kind of posed, but I also raised a few during the discussion. But just how do you feel about reopening? What phase is your organization at as well? And how do you feel about kind of that phase? Or is that make sense to you? Is it puzzling? Is it distressing? And how are we kind of managing it personally and professionally? Because I think we often are following those dual roles in both our patient care, but also in our social lives as well. So those are some of the questions. So I'll stop there and I'll stop sharing the screen.